Hi, everybody, and welcome to What's So Great About Grimsby, the place where we talk about the people and organizations that help make Grimsby a wonderful place to live. I'm Kyle Orr from St. John's Church here in Grimsby. So glad that you have joined us. And as you are watching, I would invite you, if you want to hear more episodes of what we're doing, please be sure to click the subscribe button and share this with people that you know would be interested. I am joined today by Deb Rackenjack. And Deb, why don't you tell us a little bit about who you are and what you're doing?
So I'm an organizational development specialist with Hamilton Health Sciences, and was lucky enough when the COVID pandemic started to ramp up, get asked to support some work to enable our communities to donate various items to our staff to show their appreciation for the work that they do. Mm-hmm. And so, you know, there's a bunch of us that are kind of rallying around this work, and we've been able to facilitate donations of food and drinks, snacks, comfort items, everything from massage chairs to salt lamps, so that the community can really express their appreciation for our teams.
Yeah, because I'm sure there's a lot of people that think, well, I'd like to give something, but it's really difficult, certainly in a pandemic time, because you're not really sure what's the safest way to go about doing that. So is that sort of where all of this kind of came together then, and that desire to, I guess, allow people to be supportive, but to do that in a safe way?
Yes, so we had, different organizations and individuals reaching out in a variety of ways to ask how they might do this. As you can imagine, in pandemic times, our infection control and prevention team wanted to make sure that this was happening in a way that kept both our staff and our donors safe.
Absolutely.
And so trying to minimize contact, trying to in keeping with our visitor policy and not having unnecessary people in the site, but still wanting to facilitate the generousness of our communities to our hospital staff. And so we worked closely with our health, safety, and wellness team, our infection control and prevention, to set up some guidelines around both the food preparatory guidelines that we wanted to be complied with, but also in order to facilitate safe delivery of donations. So yeah, we did spend a little bit of preemptive time, kind of getting those things in line so that it could be done well. Absolutely,
and I mean, safety is the name of the game at this point too, right? So
absolutely,
that's good that you've thought through that. So you talked a little bit about some of the things that people have shared. Can you talk a little bit more about that, and maybe how those things have been received by our healthcare workers and first responders?
Yeah, so I mean, we have just as an organization, we have had upwards of 300 donations come through, and that's all of our sites for Hamilton Health Sciences. And we have had everything from just boxes of granola bars that staff can eat when they have a split second to kind of get something in them, to meals from 5-star award-winning chefs. People have made donations of cash or money towards our foundation to purchase equipment. As you know, different medical equipment was in high need through this pandemic planning. And our community has just stepped up all the way. One of the principles that we used when we were kind of setting up these guidelines was we wanted to make sure that everyone in our organization who was contributing to the safe care of our patients was acknowledged. Not just, what we think of as typical healthcare workers, doctors and nurses, but really wanting to acknowledge everyone's support. And so that was a principle that we used as a team.
Yeah.
And so so we had some donations that came in that were directed towards certain units, or sites, and then we had some donations that were, kind of where is the best need, which really allowed our team to make sure that everyone was a receiver of this generosity, from our housekeeping staff and our facilities team to our social workers, and really wanting to make sure that everyone felt appreciated, because the hospital doesn't work without everybody.
Oh, exactly.
And so, when we hear, we've been it's very lucky. Often, we do things and we don't necessarily get to hear back the impact of the things that we've facilitated. But we've been lucky enough that many of our receivers of donation have sent us pictures of their teams enjoying the donations that came to their unit or their team. We've received many letters of thank you, which we have been lucky enough to be able to forward on to our donors. And it's just been the expressions of appreciation, both from our donors. Many donors sent through letters of appreciation, personalized. Many of our donors had patients or were patients or had family members who were on the units that they were donating to, and were really able to express their appreciation for the great care that they get at our sites. And then our staff were able to send their appreciation for those donations as well. And I think it's been very interesting, and more so in Grimsby, interestingly enough, but our donors are from a variety of sources. Our donations are from a variety of sources. We have individual families that have donated. We have corporations, big franchise corporations that have donated. And we've even had some of our community partners, like our long-term care facilities, have sent meals forward. Some of our local providers of things like honey and those types of things have sent gifts forward for our staff. And it's, just so welcomed and so generous.
Absolutely. Meets practical needs, but just also, lifts the spirits of the people that are doing that work, and good for you guys for seeing the wholeness of the team. I mean, everybody is contributing in their own way at the hospitals, and that's great that all those people are recognized, whether they're sort of at the forefront of things or they're working in the background, that they're just as essential to
absolutely
combating this pandemic. Well, that sounds like there's a lot of wonderful things happening. Are there ways that people can still make contributions to this initiative?
Absolutely. So we have a number of different donation options. So one being, if you'd like to donate food or non-food items prepared in a licensed kitchen, you can email wecare@hhs.ca. If individuals own a business and would like to offer a discount or an offer to healthcare staff, we have a website that our staff know to go to see what is available to them, and that's everything from grocery stores opening earlier to enable frontline staff and healthcare workers to shop quickly and early, to discounts on pizzas and car rentals and hotels. Or, always welcome our financial contributions through our foundations. So in Grimsby, we have the West Lincoln Memorial Hospital Foundation, and for the greater organization, we have the HHS Foundation.
Wonderful. And I'll put that information in the video description as well. If people are looking, you're wondering what that email address was, you should see it on the screen.
Yes.
As well.
And, our team will help facilitate, make drop-off easier and safe, and make sure that it will be accepted at the site. So, we want to make sure that it gets into where it deserves to be.
Yes, absolutely, and safely and efficiently. Well, I want to thank you for taking the time, Deb, to to join us and to talk about this great thing that is happening in Grimsby and across all of Hamilton Health Sciences. We appreciate your time and the work that you're doing to help bring all of this together.
And we thank your community, our community. I live in Grimsby, so yay, Grimsby.
Yes, Grimsby is just the greatest.
It is, yeah. It's my hospital too. And so, you know, I know our teams appreciate it greatly. So thank you so much.
Absolutely. Well, again, the hospital working together and people coming to support the hospital, that's all just part of what's so great about Grimsby. Thanks so much for watching. And please share this with others that you feel would like to make a contribution to provide encouragement and support to our essential workers through the We Care program. I'm Kyle Dorr, and this has been What's So Great About Grimsby. Have you discovered something great about Grimsby? We'd love to hear about it. Leave a comment on this video, and your suggestion could be used for an upcoming episode of What's So Great About Grimsby. To learn more about us, please visit www.stjohnsgrimsby.com.